Yes, I am Dr. Rajeev Raman, working in Joint and Bone Care Hospital and AMRI Salt Lake, Kolkata. Basically, I am from Hajipur, Bihar, and it's my privilege and pleasure to be here in this first Anup Master course. So I will be speaking on radiologic planning and preoperative imaging of osteoarthritic knee. And a very important talk, I think some point has been discussed by Dr. Raman Khan, my previous speaker also. So I would like to start my talk with this good quotation that proper planning and preparation prevents poor performance, and it's important in our life also. It's important in our every surgery, and TKR is a planned surgery, so you should plan your surgery properly, and for that you need routine good X-ray views, and these 5 views are important. Knee AP view, try to have a single joint weight bearing view, knee AP with full tibia, the varus stress view and the valgus stress view. The knee lateral view in 30 degree of flexion. Mind it, you should take it in 30 degree of flexion. And the scanogram, full length view, we call it orthorotangenogram, and the skyline view to see the patellofemoral joint and the patella. So these 5 views are important before planning of your total knee replacement surgery. So single knee AP standing view, why it is important? Because it is a dynamic view, and you see about the ligament laxity and all those things in single leg standing view. So ask the patient to stand on the single leg, then raise or pass perpendicular to the knee with plate placed behind the knee. And it will give you the status of the laxity of the knee, the degree of the deformity which is not there, is not seen in a supine view, is exacerbated, or you can see the amount of laxity which is there in weight bearing view. So varus deformity, which is the most common deformity we deal in our day-to-day practice, try to have a valgus stress view. Why? Because it will tell whether this varus deformity is correctable or it's not correctable. It will tell you about the medial bone defect. So once you can see it, once you have corrected this valgus deformity, you can see the medial bone defect, you can see the amount of medial bone defect which is there in this correctable varus deformity. And yes, you can plan about the medial or lateral joint of reconstruction also, whether you want to keep your wedge there, whether you want to keep a bone graft there. All valgus deformity, try to have a varus stress view. Again, it will help you to assess the correction during surgery, whether the collaterals are stretchable or contracted. If it is a correctable valgus, yes, you can correct it bring the knee to the neutral position, and yes, you can plan the amount of release which is needed for this valgus knee. So what can be planned preoperatively? It is important. For the femur, yes, you can plan for the valgus angle of the distal femoral cut. You can plan for the entry point of the femoral canal. All arthritic knee are not the same knee. Some of the knee in osteoporotic knee, you have an over or excessive bowing of the femur. So you have to adjust this femoral entry point according to your femoral bowing. For the tibia, yes, you can plan the level of proximal tibial cut and the slope, and you can adjust the tibial bowing also. And for the patella, yes, you can plan for the thickness of the patella, because we don't usually recommend patella resurfacing for patients who are having a thickness of the lesser thickness of the patella, but there is every chance of patella fracture. So what are the things we need to plan preoperatively by doing this X-ray? First thing, the degree of release that need to be done, whether it is a correctable valgus or a varus deformity, what is the amount of release you want to do in those contracted knee, on those arthritic knee. Yes, you can plan your component size. Yes, you can see what are the osteophytes present on the mediolateral aspect or anteroposterior aspect which you want to remove, and not the least osteoporosis, because in this era we are the capital of osteoporosis in world now. So we are dealing a lot of patients who are having a gross osteoporosis, and you can plan your implant according to that. Scanogram, very important, discussed by Dr. Amankat also. Always do a scanogram before doing planning for knee replacement any of your patient, because it will guide you regarding the extraarticular deformity, it will guide you regarding the coxa vara or valga deformity, where you have to plan your cut, distal femur cut differently, and yes, it will plan you to correct or calculate the deformity properly. So always do a orthorotangenogram or full length X-ray in all knee where you are planning for total knee replacement. So knee lateral view, what are the things we want to see? We want to see the posterior slope. The posterior slope varies. If you did the study, the slope varies from 3 to 10 degree in Indian population. You want to see the femoral bowing. Not all femurs are straight in the lateral view. In osteoporotic bone, you may have a excessive bowing of the femur, dorsal curvature of the femur. You want to see the patella, level of the patella, whether it's a patella alta or a patella bassa, and you want to see the thickness of the patella when you are planning for resurfacing. So knee lateral view, you can plan for a patellofemoral component, you can see your patelloosteophytes, and definitely you can see the posterior osteophytes. You can plan, yes, what are the osteophytes I want to remove during my surgery from the posterior capsule. For patella height, yes, you may deal with a patient having a higher patella or a low patella, and that will help you in planning your surgery regarding the exposure, because sometime in contracted knee, sometime in deformed knee, your patella is going quite high up, so you have to go for the cordyceps snip approach or sometime extensile approach to expose those knee. For patella cut, yes, in lateral view and in skyline view, you can measure the thickness of the patella. You can plan your patella cut also, and you can judge on the merchant view what is the congruence of the or alignment of the patellofemoral joint, and that will justify you, that will help you in balancing the patellofemoral ligamento balancing. The most important point, most of us don't do in our total knee arthroplasty templating. Yes, you can go for a tibial templating, you can size your tibia component, you can size your femoral component with a proper component size which is there with a 10% magnification, and that will help you keeping the extreme sizes there, because sometime in Indian female you have extreme short knee, you don't, if your company has, if you have not planned properly, you will not get those component sizes, either extreme large size or extreme smaller size in a tray during operation, so your whole of the operation will go in a soap. And this is the most important part. When you are dealing with osteoporotic bone, and you can judge this preoperatively with your routine X-ray, never use all polycomponent, there is a chance of sinking. You should be very careful in handling those bone, and careful hammering of prosthesis is important, but there is every chance of fracture of the tibial, proximal tibia or a distal femur. So just I would like to remind you, when you are planning for a TKR, go for this 5 X-ray. Knee AP, ask your patient to go get a single joint bearing knee AP X-ray, do a knee AP with full tibia in varus stress view and a valgus stress view, do a knee lateral view in a 30 degree of flexion. Scanogram is the most important part. Don't plan or don't take your patient to OTB without doing a scanogram, because you can see and you can calculate the correct deformity, you can see the extraarticular deformity, and always do the skyline view of the patella. Thank you. I would like all of you to invite our Kolkata lower limb course. It's one of the biggest arthroscopy course in the East, and this time we are having it on 17 to 19 May 2019 at Sobhumi, Kolkata, and Rueda is our academic partner, and you can register at outside also for Kolkata lower limb course. You can contact Mr. Devnath. He is there. He will help you out in registration, whether you want to do online registration or offline registration. Thank you.